Hello and welcome to From the Editor. I'm Mike Shearer, Executive Editor of the Columbus Dispatch at Dispatch.com. I'm here today with Samantha Hendrickson, our Business of Healthcare reporter here at the Dispatch, and she's here to talk about her cover story this week that's called Destination Medicine, about a program at the Ohio State University Wexner Medical Center. So we'll get to that here in just a second, but welcome, Samantha.
Thank you so much. Happy to be here.
Glad you're here. So let's, first of all, I always like to start with about what your beat is here at the Dispatch and what you do in a normal week. So just kind of tell us a little bit about what you're covering and how you're serving our readers through your work.
So my beat title is Medical Business and Healthcare Reporter. So anything that falls within that umbrella. I could be writing about biotech development, which we're seeing a lot of right now in Columbus. But I also often am talking to all of the different hospitals. We have 4 major health systems, some of which are world-renowned, which we will talk about in this story. Yeah. And so I'm often coordinating with them, but also, healthcare is a very important topic always, but especially right now with a lot of the national changes. So yes. Anything that really falls under that umbrella is what I'm doing. And that's what my day-to-day looks like is taking a look at things that are going on nationally. How are they affecting Ohioans? Or how are these major health systems serving Central Ohio? And how Columbus is growing in the healthcare and biotech space.
Which is obviously considerable. All the construction we see going on at Wexner Medical Center and at Nationwide Children's downtown here, mm-hmm. Grant and others. The new hospital up in Sawmill Road there from Mount Carmel, mm-hmm. and all the other things that are going on. So lots happening there.
I like to say that if you throw a rock, you hit a hospital construction project in Central Ohio.
All right, so today's story tell us about how this came about. I guess you were covering a story recently, and it kind of spawned this idea. That story dealt with sickle cell. Yes. So tell us about that.
Yeah, so I was invited by the Ohio State University Comprehensive Cancer Center, which everybody here knows as the James, on a really exciting patient journey that they had. So there was a young man from Saudi Arabia who was, they say, functionally cured of sickle cell disease. He's one of the first adults in the world to be effectively cured of sickle cell disease, which, if you don't know what that is, it's a pretty debilitating blood condition. Mm-hmm. People are often in a lot of pain. They're often immunocompromised. It has a shortened lifespan. It's a very difficult disease to live with. And so this young man came all the way from the United Arab Emirates to be a patient at OSU. He was a really good candidate for it, and OSU utilized gene therapy to cure him. It was a very, very big deal. Okay. And I thought it was really interesting that we had a patient from the United Arab Emirates coming all the way to Ohio. Mm-hmm. And in the process of going to a cake celebration ceremony with him and his doctors and an interpreter and anybody who had kind of touched his life while he was there for over a year at OSU, I got to meet members of the Destination Medicine program. The Destination Medicine program is a program at OSU that, think of trying to plan an international trip, mm-hmm. right?
Yeah.
Very stressful. Think of getting a very severe diagnosis, right? Think of then having to think about the treatment of that. And then what are you going to do with your family? What are you going to do about insurance? What are you going to do about all of these things when you know that the care that you need is in a place that's very, very far away? And all of those things are all mixed together. Incredibly stressful. It would be incredibly difficult to focus on treatment. So the Destination Medicine program, the Destination Medicine Global Healthcare Program is its full name, yes. Essentially helps take care of that so that patients can focus on being patients, doctors can focus on being doctors, and they put together things like keeping track of medical records, appointment schedules, navigating insurance. If you're there for over a year and you have children, they help enroll your children in school in Ohio. There's all of these little things that we don't think about when we're just trying to get well.
So the patient experience is largely the same. It's all the other parts of being a patient and the family and all the other impacts in your life that they really focus on supporting through this program.
Yeah, especially if you're coming out of state or from another country. So I got to talk to Millie Valverde. She is the lead of the Destination mm-hmm. Medicine program. A very interesting woman. She has a very interesting life in healthcare. Who's very passionate about just making sure, again, that doctors can be doctors and patients can be patients, mm-hmm. And they can be there to support that relationship and just help people focus on getting well.
So this kind of began, I mean, part of this is, now you write in your story that they have now helped heal thousands of patients from more than 120 countries in the last 12 years.
Yeah.
That's a lot of folks, obviously. They also, the beginning of this also was the fact that you have world-renowned doctors that came to Columbus to work there. And you cite two here, a neurosurgeon from Brazil and another doctor, I'm not good with medical words here, head and neck surgeon, who came to Ohio State and brought with them patients who knew they were there and wanted to. Yeah. So talk about that a little bit. I mean, part of this is obviously having that world caliber medical care available.
I think what's really cool is that, like, I don't know that a lot of people know just how internationally known the James is. Yeah. I mean, kind of evidenced if you read my story, like it'll become a little bit more obvious. Yeah. But just how much recruitment comes of just like specialists from all over the world come to work at OSU and especially at the James, because so much innovation and discovery is happening there. So Dr. Daniel Prevedello, he is originally from Brazil, but he is a world-renowned neurosurgeon. And he and Dr. Corral, head and neck surgeon, worked together at a hospital prior to this. And because they are so innovative in their field, they actually invented a surgery. It's a surgery within the last decade or so, where instead of, this is going to get a little very medical. Yes. But instead of for like a brain surgery, removing a tumor, going straight through the skull, a craniotomy, what they do is to minimize that impact. They actually go through the nasal passages to help mostly get rid of things like tumors, skull-based surgery. They invented it, and they're here at OSU. And so when you have that kind of innovation, you know, you're going to bring a lot of people with you. And what they found is that OSU 12 years ago didn't have the infrastructure to help them. So they were set up with, you know, trying to help their patients navigate language barriers and cultural issues and where are they going to live, when they really just needed to focus on being doctors. And that's when they went to Millie Valverde, who is the director of the Destination Medicine program. And she'd done this before. She was very uniquely qualified. You know, she grew up in Spain, and she did this already at a private hospital in Spain. Wow. And she'd already run the interpretive services department at OSU for a long time. So it was really, honestly, the perfect fit from my understanding, talking to people. And kind of the rest is history. It's been 12 years, thousands of patients later, hundreds of countries later. Do
you have a feel for how unusual it is to have this kind of program at a hospital in the Midwest or in a major city? Or
well, I know that, honestly, this does not just serve other countries, right? Like, this is also a program for other states. So if you go onto the Destination Medicine Global Healthcare site, you'll see a lot of testimonials of people from other states. Okay. You know, there are people who come from major cities like Chicago, like New York, that don't have the care that's happening, and then don't have the same kind of help.
Well, and obviously there's world-class care in places like Chicago, but just the unique nature of certain illnesses happens to line up with the experts here in Columbus. Is that right? Okay.
Yeah, exactly.
So I'm sure there are probably patients who go other directions out of Columbus at times for the same reason, but okay. So, but some people might ask, well, what are the benefits to the Columbus area for this to have folks come in here? And the answer we talked about a little earlier was, well, they're getting all this expertise on these cases that may help someone here in Columbus or Ohio or wherever be cured too. So
I think the biggest thing that was stressed to me is that, like, when, you know, people who might ask, like, why not just focus on here? Like, you're serving this population, that's where you're here. Yeah. When medical innovations happen, when medical discoveries happen, everybody benefits, right? So if, you know, there is for example, the sickle cell patient, the fact that gene therapy worked, he was a good candidate for it. The timing worked out for this therapy. They had a partnership with the United Arab Emirates. The fact that he was effectively cured, that's going to impact people around the world and people here in Central Ohio who might have sickle cell disease. But also beyond just destination medicine, helping patients be able to get treatment and not worry about the day-to-day, they also create these partnerships and memorandums of understanding with other institutions and sometimes even entire governments to have visiting scholars, so training back and forth, to share resources, academic resources, to do trainings, to help set up programs. I got to talk to a doctor from Ecuador who came to OSU and trained for a year specifically in sarcoma. Sarcoma is a bone cancer.
Yeah.
And he got to train for a year, and now they set up a tumor board in Ecuador specifically to look at sarcoma cases with expertise from OSU, and this man who was trained at OSU, who is now able to bring this kind of care back to his home country. But it's this knowledge sharing that's happening, right? Where yes, it's in Ecuador, but it's also coming back into Central Ohio, the Columbus area, and the entire United States. We do something like this.
That's fantastic. Okay, great. That's very insightful. I mean, the amount of quality healthcare that's in this community is staggering at times. I mean, and we see that in the construction in Ohio State, the new 26-story tower that's going to open next year. And there's just a lot of innovation out there. All right, so you got to meet some folks from around the globe here, and one from Saudi Arabia, one from Ecuador. These are patients. One from Micronesia, and one from the Netherlands. Tell us about just what did you learn from them about the experience they're having here in Ohio?
I think I learned that what we have in Ohio is very unique. I'm not going to name names by any means, but they said that they had gone to other institutions in the United States who are very well known, and they couldn't get that kind of care that they did at OSU. I think the biggest thing that stood out to me is how so much of just the actual medical care was married with them feeling very at home and safe with the team that they had. Because I think when you're going into something like oncology, just all of the different doctors that I met as well on top of it, it's such a passion. Like it's such a driving force for them, and they really want to take care of people and to figure out how to help them. And that was the impression that all of these people got. I mean, they talked about how the destination medicine team, like Millie and the people who work under her became like their family, made their life so much easier. But the same thing with the doctors. Their doctors became like their family because they were going through these intensive things. And that was really across the board. They feeling really taken care of, and like there was a burden lifted off of their shoulders.
And if you're from a foreign country and you're told to be at the Wexner Medical Center in Columbus, Ohio next Tuesday at 10 a.m., that's not an easy ask necessarily.
No, and as we all in Columbus know, it is not the easiest to get to our airport.
No,
United States. Fingers crossed we're working on that. But these are people who are trying to save their own lives. Really, I talked to a father and a daughter from Ecuador, the Nahas family, and he talks about getting on a red-eye flight to Columbus in the middle of the pandemic because doctors in Ecuador couldn't perform the surgery that his daughter needed. And the fear and the uncertainty, I can't even imagine what that would feel like. But they all, said that this, Andrea Nahas is now 21 years old and a university student and thriving. And that's because of the care that she got at OSU.
Great. All right, well, thank you so much for taking time to chat with me today about your story. Looking forward to reading it this weekend in the paper. Well, I've already read it, but everyone else looks forward to reading it this weekend in the paper and on dispatch.com. But thanks again.
Thank you so much.
All right, folks, thanks for joining us this week, and we'll talk to you next time.